Thank you all for joining us today. This is the first seminar of 2022, and we're really thrilled to have you here as well as a great speaker. So welcome to the UC Davis Western Center for Agricultural Health and Safety monthly seminar. Next slide. I'm going to go over a few housekeeping items before turning the floor over to our speaker. This seminar is being recorded, and we will have the recordings in both English and Spanish available on YouTube within a week or so. All participants are muted. If you have questions for the speaker or if you have any technical issues, please use the chat function to submit your comments and questions, and we will have a Q&A session at the end of the presentation. As Yahaira said, Spanish interpretation is available, and you can choose English or Spanish from the interpretation language selection below, and that's that globe icon in your Zoom bar at the bottom. We also have closed captioning available. You can select the CC icon below and click Show Subtitle. Thanks. Next slide. So today we are going to have Dr. Marlier from UCLA talk about agricultural worker exposure to wildfire smoke pollution in California. And unfortunately, this is an ongoing concern, and Dr. Marlier has some really insightful ways of looking at where we might have future acute smoke pollution. So I'm going to turn it over to you.
Great. Let me share my slides really quickly. Okay, can everyone see that?
Yes.
Great. Well, thank you, Heather, for that introduction and for the invitation to come here to speak today. My name is Miriam Marlier. I'm an assistant professor at UCLA in our Environmental Health Sciences department. And I'm excited today to share some ongoing research that I've been working on looking at agricultural worker exposure to wildfire smoke pollution. So I'd like to start with a roadmap for my presentation today. I'm going to begin with an overview of the links between climate change and wildfire activity, both globally, but with a particular focus here in the Western US. And while there are many different health risks that wildfires pose to communities, today I'm going to focus on one category of exposure, and that is the contribution of fires to air pollution. Next, I will share results from recent research that examines the risks specifically to outdoor agricultural workers in California to this wildfire contributed smoke pollution under different climate change scenarios. And finally, I will conclude with some thoughts on how this links to different policy options and future research directions in order to prioritize outdoor worker health. So let's get started with some motivation for why I'll be focusing my talk on wildfires today. Images like this have become increasingly familiar to those of us in California and other locations that have experienced extreme fires firsthand. And California's 2020 fire season was one of the most extreme in recent history. It was followed by another significant season last summer. And what you're seeing here are images collected by a satellite in early September 2020 over Washington, Oregon, and Northern California. So we see that there are actively burning fires in those orange and red shades, and the large amount of smoke production spreading across the West Coast and further areas as well. So my interest here is looking at vulnerabilities to pollution from fires such as these. So wildfire patterns are changing not just in California, but around many parts of the world. And this map is showing where fires occur, as well as changes in the length of the fire season. So this is from a study that was conducted over a roughly 30-year period, and the authors found longer fire seasons over roughly a quarter of vegetated areas. Longer fire seasons are marked in these red colors. You see the Western US as one of these parts. And while this plot is showing the fire season itself, fire patterns are driven by multiple interacting factors. This includes climate, fuel loads, as well as human activities. And I want to spend a little bit more time on this question. What contributes to fire activity? Because this is really important when we're starting to think about mapping and understanding the effects on human health. But there's no simple answer to this question because it depends on a mixture of human and natural factors. And I've illustrated some very general categories here. So let's start on the top with the influence of climate. So fire seasons are defined by conditions conducive for fires to occur. You can think hot and dry weather. But there are also longer term climate change trends that are changing how severe and how frequent these conditions are. Moving to the bottom, we consider fuel loads. So this includes vegetation type and how much material there is available to burn. And this also incorporates elements of natural fire regimes. That includes ecosystems here in California that traditionally experienced more frequent but low intensity burning. And finally, considering human activities on this bottom left, we think about how people provide ignition sources that could either be intentional or unintentional through sparks that could start a wildfire. And suppression, which considers how people have changed natural fire regimes. And that's particularly relevant here in California. And an important takeaway here as well is that these drivers do not occur in isolation, but there are multiple interrelated factors. But I'd like to provide a little bit more context before I dive into our research results on these individual factors. So the first component is thinking about climate change, and this has been implicated in our observed wildfire trends. So this plot is showing results from an interesting study that modeled wildfire activity in the Western US, both with and without the influence of climate change. The yellow bar is showing what we would expect if observed climate change over the past several decades had not happened. And the orange is showing the additional contribution when the climate change component is added back in. So critically, what we see here is that observed wildfire trends cannot be reproduced without including climate change, that orange bar. And this has approximately doubled our observed forest fire activity in the Western US over the past few decades. So how is climate change influencing fire likelihood? Well, California has been experiencing both greater areas as well as higher severity of drought conditions. We can see that here in this graph that is showing the increasing duration of what are termed exceptional droughts across the state over a 20-year period, which you can see on the x-axis. And we see, looking back to our most recent summer, most of the state was either in exceptional, extreme, or severe drought, these orange, red, and dark red shades. So in the short term, this is making vegetation more susceptible to burning, but in the long term, it can also create more dead fuel. And the last component that I want to highlight on this background about wildfire and changes is that it's not just climate change and vegetation patterns alone. People also have a very important influence on wildfire patterns. In the Western US, more and more people are living in what is known as the wildland-urban interface. This represents the zone between human development and wildland vegetation. And growth in this area means that there are both potentially more ignition sources, but it also means that there are more people and property at risk of wildfires. We see on this map on the left that California has a relatively large proportion of fires that are burning in this wildland-urban interface. So with this background on what is contributing to changes in fire activity, now I want to shift gears and turn to the focus of my talk today, which is how fires can impact public health. So there are two broad categories that we could consider. The first are local impacts on public safety. This is particularly concerning for communities who live close to where the fires occur, as well as our first responders. And today I'm going to talk about the regional impacts of wildfires through the contribution to air pollution. And this is going to depend on both the intensity of fires themselves, as well as how and where these emissions are transported in the atmosphere. So what you're seeing here is a conceptual model that links smoke to regional human health impacts and some of the factors that we need to consider. This includes emissions, which will be dependent on how much area burns, the type of vegetation, if it's grasslands or forest, for example, the intensity of burning. The next step is the dispersion from source regions in the atmosphere, and how this can expose populations located close to where fires occur, as well as populations at some distance away. And finally, population vulnerability. So this depends not just on the number of people who are exposed, but also their underlying health sensitivity and their ability to adapt to wildfire smoke exposure. Now, while wildfire smoke contributes to several air pollutants, today I'm going to be focusing on the contribution to fine particulate matter, or PM2.5. So these are particles that are smaller than 2.5 microns in diameter. They're much finer than the width of a human hair. And for the rest of my talk, I'm going to refer to the wildfire-specific contribution as smoke PM2.5. Previous epidemiological studies have linked smoke PM2.5 exposure to mortality and respiratory morbidity, so including asthma, chronic obstructive pulmonary disease, bronchitis. And there's mixed and growing associations with adverse impacts on cardiovascular function. Recent studies also suggest that PM2.5 contributed by smoke could potentially be more toxic than from other sources of PM2.5. So taken together, smoke PM2.5 from fires is causing more than 300,000 deaths per year. And I've highlighted here, this is from a global study, a global atmospheric modeling study that separated out the fire contribution to pollution. And I've highlighted my focus here today on the map. But recent estimates also suggest that anywhere from 10 to 20% of the total global PM2.5 mortality burden is specifically due to fires. And while this plot is showing average conditions, there's two important things that I also want to highlight. One is that there's going to be strong year-to-year variability in fire activity and the subsequent health effects. And also this plot is showing mortality effects, but smoke PM2.5 can also contribute to other health outcomes. Now I want to get to on that conceptual diagram, that last piece that was looking at vulnerability. So wildfire smoke, certain populations will be more vulnerable to wildfire smoke pollution. So this includes people who have existing asthma or other respiratory diseases. Exposure to the wildfire smoke can exacerbate breathing difficulties. It can also contribute to cardiovascular related events. Children, especially younger children, are more sensitive to pollution because they inhale more air relative to their body weight. Pregnant women are also vulnerable, and exposure to wildfire smoke has been linked to reduced birth weight, among other adverse outcomes. Elderly adults or people of lower socioeconomic status may be more vulnerable due to underlying health impacts, as well as a lack of access to air conditioning or air filtration, for example. And finally, outdoor workers. This is going to be the focus of the research that I'll present today. This is a function both of exposure as well as potentially underlying health status as well. And finally, extending this question about the health effects from smoke PM 2.5 and underlying vulnerabilities, there are several actions that people and communities can take to protect themselves. And I have here an example from the California Air Resources Board. So when we think about ways to protect yourself from wildfire smoke, it's important to have the necessary information to inform decisions and possible behavioral changes. We see here several options that CARB lays out, including checking air quality status, staying indoors with the windows and doors closed, wearing respirators, and avoiding outdoor activities. But from this, it's important to remember that not all people will equally be able to follow these guidelines. So now I want to move to the second part of my talk. So this is taking information that I've introduced on the drivers of fire activity and then thinking about the public health consequences. And specifically what I'm interested in here is that link between changing climate and fire activity and what this means for smoke exposure, focusing on one potentially vulnerable groups, that's outdoor agricultural workers. So I'd like to start with some motivation for our study. We started working on this research just after the 2020 fire season, which I'm sure many people who are joining today likely experienced firsthand. And I have here some statistics for the 2020 fire season across the state, and this was collected by CAL FIRE, our state firefighting agency. So we see that close to 2 million hectares burned. This is larger than the state of Connecticut. This was followed by 1.2 million hectares in 2021. In a single season, 5 of the 6 largest fires had burned since documented since the 1930s. And while 18 of the top 20 most destructive fires have occurred since 2000, 5 of these were in 2020 alone. And with these severe fires come concerns for regional air quality and public health, as I've discussed earlier. So this is an image taken from a day in September 2020 from the EPA Air Now site. And this provides information on where fires are actively burning and air quality effects. So you can see that here. I know it's a little bit small, but the fire icons show those active fire locations. And then the shapes are the locations of air quality monitors, and they're color coded by status, going from good air quality, which is green, all the way to hazardous, which is that dark purple color. So what do we see here? Well, California during the wildfire season can have some of the worst air quality in the country. And taking a longer term perspective, while much of the US has experienced air quality improvements in past decades, wildfires are responsible for counteracting some of these gains, particularly in the Western US. I also want to note that our most recent fire seasons here in California have capped a general increase in wildfire burned area over the past several decades. What you're seeing here is a graph from the early 1970s to 2018. And it shows that California's summer wildfire burned area in forests has increased 8-fold. And this has been linked to this increasingly dry weather conditions. I would note as well that the 2020 fire season would be off the charts from this scale, approximately twice the 2018 season. And you also see here different seasonal and regional dynamics. Later in the year, in October to December, that orange color, those fires are more typical along the southern coast, while Northern California regions typically burn earlier in the year. And looking to the future, recent studies suggest that the contribution of wildfires to total air pollution is going to increase with future climate change. This is showing results from a study that modeled wildfire activity through the end of the century under 2 different future climate change scenarios. So the gray bars show that air pollution from other sources, so things like transportation or industry, will likely decline by the mid to end of this century. But pollution from wildfires is expected to increase. And while this study was conducted across the US, it highlighted that the Western US is particularly vulnerable. So all of this background information and motivation now brings me to a recent collaborative study that I would like to share today. So our goal with this study is to integrate advances in climate modeling of fire activity with subsequent effects for air pollution exposure and public health. So this is integrating several of the topics that I have introduced so far. So several studies have estimated that wildfire frequency and severity is going to increase in places like California this century. And here we focus specifically on outdoor agricultural workers in California because this has not been examined from this perspective in the past. And this is concerning because public health measures, if they're based on past patterns of fire activity, may not adequately represent potential health risks in the future. So this brings us to our overarching question, which is, what are the potential health risks to outdoor agricultural workers due to wildfires associated with future climate change? And again, we're focused on agricultural workers because they are particularly vulnerable to wildfire smoke exposure due to the outdoor as well as physically demanding nature of their work. So to answer this overarching question, we turned to a 3-step interdisciplinary approach. And I'm going to talk through each of these steps in the next few slides, but I wanted to start with an overview of our methods. So first, we analyze results from an atmospheric model that incorporates future climate change scenarios to estimate the past as well as future distributions of wildfire smoke PM2.5. Second, we overlay these modeling results with the distribution of outdoor agricultural workers during the burning season in both the past and future periods. And third, we compare the exposure of workers to smoke pollution to existing worker protection measures that have been implemented at the state level. So let me go through these steps in a little bit more detail. So first, we used results from an atmospheric chemical transport model called GeoSchem. And this is a 3-dimensional model that simulates the transport and evolution of air pollutants in the atmosphere. And this is a really powerful tool because it allows us to simulate the contributions of fires versus non-fire emissions to air pollution under both past and future climate change. So you see on the left an example of the results from these modeling efforts, which were led by my colleague Coco Liu. And we also explored, using the model results, the changing incidence of a term called a smoke wave. And this is meant to be analogous to what might be more familiar to you, a heat wave. And this is defined as 2 consecutive days or more above extreme wildfire PM 2.5 concentrations. Our next step was to overlay these changing smoke PM 2.5 concentrations with where agricultural workers are located. And we used data from California's Labor Market Division to match our past time period, 2004 to 2009. I will note that this is likely conservative from undercounting of seasonal or part-time or undocumented workers. But it's also important because many of these areas with high populations of agricultural workers also have existing high pollution levels from other sources. So wildfires would only be adding to this pollution burden. And in this step, we compute exposure in terms of worker days. So that is effectively the number of workers multiplied by the number of days above a certain pollution threshold. And finally, we compared our modeling results to existing worker protection measures. So California's Division of Occupational Safety and Health, or Cal-OSHA, has a regulation, section 5141.1, to protect workers exposed to wildfire smoke. And when the air quality index, or the AQI, is above 151, so this corresponds to daily PM 2.5 above approximately 55 micrograms per cubic meter, various protective measures start. So this is corresponding to air quality that is considered unhealthy, very unhealthy, or even hazardous. And with these thresholds, these different worker protection measures required of employers include fundamentally reducing worker exposure to unhealthy air quality during these wildfire events. That could include PPE or wearing respirators, relocating work if it's practical, or changing work schedules, among other examples. So now I want to move to our results from this study. So I know this figure is showing a lot. I will walk you through it piece by piece. So what you're seeing here are these different dimensions of smoke exposure in the rows, and for different time periods in the columns, past, future, and then the change between the two. So starting with the top row, we see that future smoke PM 2.5 is projected to be highest in Northern California counties. But moving to the middle, which is the number of smoke wave days, we see, especially when we're looking at this third column, or the change between the past and the future, that the Central Coast and Central Valley are highly vulnerable to increasing smoke wave duration. Again, a smoke wave is this sustained high intensity smoke pollution. And finally, moving to the bottom row, so this is where we're now coupling worker locations with these modeled smoke results. We see that counties, particularly in Central California, are highly vulnerable. So these are important agricultural regions with high numbers of workers. And then it's coupled with our modeling results where we see increases in projected smoke PM 2.5. Next, I want to show some results looking according to those different PM 2.5 thresholds that were used in the Cal-OSHA regulation. So here, the rows are showing different PM 2.5 thresholds. It gets more hazardous as you move down the rows. And the columns are showing how many times we exceed that threshold in the past period as well as in the future. So what are some takeaways here? Well, first we see that the most extreme concentrations in our model aren't exceeded at all in the past, but they will be in the future. And we also tracked, in these results, we're looking at all sources of pollution, but we also tracked the specific contributions of wildfire smoke. And as we move to these more extreme concentrations, so moving down the rows, we see that smoke plays a more and more important role. Wildfire smoke is contributing more than 90% of the PM 2.5 exposure at the unhealthy or higher levels. And finally, I want to share some results from the past slide, but now in map form, so that you can see some of the spatial patterns instead of it being aggregated across the entire state. So we found that there was a 190% increase in agricultural worker exposure to unhealthy levels of air pollution during the burning season when we're comparing the future to the past. And many of the top counties for agricultural employment in the past had no exceedances over unhealthy air quality, but this is expected to be exceeded going forward into the future. So, particularly as we get to those extreme concentration levels, which are deemed hazardous levels of pollution, these were not exceeded at all in the past, but are expected to expose agricultural workers in the future. So what are some takeaways from our research? Well, first, we find that wildfire smoke pollution is and is expected to continue to be a threat for outdoor agricultural worker health. And we see this in the average smoke PM 2.5 exposures, as well as in the duration and intensity of smokewave conditions. Second, when we track the contributions of wildfire smoke separately from other pollution sources like industry or traffic, we find that wildfire smoke contributions are higher at the more extreme pollution levels. So what is termed unhealthy, very unhealthy, or hazardous. And third, agricultural regions, particularly in the Central Valley and Central Coast, that have high numbers of agricultural workers is also coupled with projected changes in the future burden of smoke pollution. So some areas that have not yet experienced these intense smoke pollution effects in the past may increasingly be exposed in the future. Before I move on to the implications of this work, I do want to note some uncertainties in our analysis that we plan to address in future work. So first, we conducted our analysis at the county scale in California, and this was due to the data availability, both on the atmospheric modeling side as well as worker information. But it's important to remember that this does smooth over finer scale variability in smoke pollution exposure, such as those peak concentrations we would expect for workers located immediately downwind of a fire, for example. Second, we do not differentiate between different types of agriculture or variations in the number of hours worked or the changing future distribution of workers. That data was not available to us in the scope of this study, but it's something that we're interested in exploring with collaborators in future work. And third, our statistical fire model that was used to estimate our future smoke pollution burdens was conducted before we had our most recent wildfire seasons like 2020. So an interesting follow-on study could incorporate these years into our climate change projections. And finally, I want to shift gears to the last part of my talk today. And here I will discuss some thoughts on the implications of this work and some future analyses that could help to provide additional insights for research communities as well as worker safety communities. I'll start here with an overview of some next steps to follow from the research that I've just presented. I'll go through some additional details in the next few slides, but I wanted to start with this, a brief introduction. So a major takeaway to come from our work is the need to consider these changes in at-risk regions associated with climate change and how the distribution of vulnerable locations across the state may shift. And with this information, we can target interventions such as expanding ground station monitoring of air pollution, using this to pilot local systems. There's some interesting examples that have recently been implemented that aim to directly warn workers about dangerous air quality during wildfire events. Second is using forecasting tools to understand near-term potential changes in wildfire smoke pollution. And third is starting to think about the multiple climate-related exposures that agricultural workers may be exposed to. So let me go through a few more details on each of these components. So first, thinking about ground station monitoring distribution. This is showing a map of county level smoke PM 2.5 exposure during 2020 and the location of monitors. So you'll note, especially in rural counties, there may only be a handful across the entire county. New advances such as low-cost sensor networks like Purple Air, for example, can provide more spatial coverage. But it's important overall to consider this distribution because air quality monitoring sites may not be located close to where workers are located. And I'll also note that many stations report total PM 2.5. So this could be contributed by multiple sources, including traffic or industry dust, as well as wildfires. And this is something that we can address by combining this with modeling approaches. So the next extension of this work is how we can couple the information from ground monitors with, for example, short-term forecasts of smoke to give workers and employers advanced warning of likely smoke impacts. This is one example from NOAA's high-resolution rapid refresh model, also known as the HER smoke model. And this system couples satellite fire detections with forecasted wind and weather to predict smoke-specific PM 2.5 a few days in advance. So this can be extremely useful for providing advanced warning about air quality impacts, specifically from fires. And it's a different perspective than the decades out climate change projections that we focused on in our study. The next extension of this work to potentially consider is the fact that climate-related hazards rarely occur in isolation. So, for example, wildfire smoke exposure may be more likely to occur during periods of extreme heat. Heat could potentially exacerbate mortality and morbidity associated with this smoke PM 2.5 exposure. This term is often called compounding exposure, and this refers to the fact that communities aren't exposed to isolated hazards. So in future work, we're interested in how agricultural workers may be particularly vulnerable to these co-exposures. So to wrap up, before we get into the Q&A, the Section 5141 regulations are focused on the unhealthy to hazardous levels of pollution. But health effects can also be felt at more moderate levels of air pollution exposure. So going forward, we may need to think more about how to protect workers, not just at these more extreme levels, but at more moderate or lower pollution levels as well that may also be harmful for health. Second, our atmospheric modeling approach indicates that these shifting patterns of wildfire smoke exposure associated with future climate change may expose new agricultural regions in the state to smoke pollution. So our efforts to anticipate this and protect worker health will need to consider these climate-related changes in the absence of any other changes as well. And finally, we've identified several opportunities to extend this research by our team and by others in the field to measure and predict smoke PM 2.5 to protect against these vulnerable hazards, including overlapping exposures that may happen at the same time. So I would like to conclude with recognizing my colleagues and collaborators on this project, as well as our funding sources. As I'm sure became clear during the course of my talk, this research drew from expertise from multiple disciplines from folks on our team. So I'm very appreciative of everyone who helped with this study. And with that, I will be happy to take any questions. Thank you.
Thank you so much, Miriam. I'm actually going to ask you to keep your slides up because the first thing I'd like to do is ask you to go back to slide, I think it's probably around 26 or so. It's the exceedances over worker protection threshold table. We had a few questions about that. That's exactly right. So one question related to, it looks like in the daily, both of the daily exceedances columns, there's a number and then a number in parentheses. Could you describe that a little bit more?
Yes, I'm so sorry if I glossed over that. So what we're seeing here in the daily exceedances column is the first number is averaging over the number, all of the counties across the state. The average number of daily exceedances over each threshold, but it's giving us a state level average. The number in parentheses is saying how many counties experienced at least one exceedance. So we see here at the lower levels of pollution, almost all of the counties are experiencing exceedances over the pollution levels, but as we get to the more extreme levels, it's much fewer.
Thank you. And then could you also describe the exposure, the worker days columns as well, please?
Yes, yeah, I'm happy to. So I know there's a lot going on in this table. I was trying to pack a lot of information into one slide. So what we're seeing on the exposure side, so the exceedances, that is a function of our atmospheric modeling results alone. The exposure in terms of worker days is now coupling that with where agricultural workers are actually located. So that's effectively that metric that I introduced earlier, where it's the number of days over that pollution threshold multiplied by the number of people who are located at that pollution, in that county with that exceedance over that threshold.
Thank you. So based on the work you've done so far, have you been able to assess whether or not the Cal OSHA worker protection around wildfire smoke rule has protected workers from smoke exposure?
So that's something that we're interested in exploring in future work, potentially, if we can couple with more on the ground information and survey data, for example. So that's something that we would really like to explore. But in this study, we were focused more on that contrast between past exposure and these simulated future concentrations under future climate change scenarios. And so as a function of the way the study was designed, we can't look forward decades into the future and survey workers. So that was not a component of this study, but it's a really great point and something that we hope to address in future work.
Great, thank you. Okay, here's another question I'm going to go through. Let's see. Aside from improving monitoring and forecast systems, can you talk about specific interventions that could be supported by policy aside from PPE provisions?
That's a great question. So, and I will answer that recognizing that my perspective, my training is in atmospheric sciences and not on the policy side. So what I would say that we're looking at from this work is how fundamentally we need some of this we need the information to support policy. So that's what we're aiming to do here is, you know, the focus of this study again was looking at that contrast between past and future changes, recognizing that if we design those policies on what has happened in the past, we may lose that ability to anticipate what could be happening in the future. So that was really the goal of this work. But I would say in terms of other policy actions, having this information, having it be publicly available, that's really the key that we're focused on with our research. But I know that some of my colleagues who are more policy focused might have a different answer.
Well, this is certainly an important basis, and especially giving some geographic location to where maybe those pilot policy studies or interventions can take place, because we know where in the future there's going to be greater smoke days proportionate to the past experiences.
Mm-hmm. That was one of, yeah, I'm glad you brought that up. Was one of the goals of this work too, is to see, are there certain counties that hadn't experienced these severe pollution levels, and so maybe aren't prepared, and do we need to think about local interventions in these areas in the future?
Great. Okay, so let's see, there's a couple more questions, and then we're going to end a few minutes before the hour today. Okay, so you mentioned that more monitors would be helpful, and you did mention that purple air monitors that exist. Could you discuss any studies about the accuracy of other air monitoring networks, kind of like purple air?
So I haven't worked directly with purple air data, but I do know that I have some colleagues here at UCLA and other institutions who are looking at assessing that the quality of these low-cost sensor networks. What I would focus on, particularly a takeaway from this work, is to think about the locations, because with the low-cost sensor networks, for example, there's both potential calibration issues that I know folks in the research community are looking at quite closely, but it's also where those are located. So far, if we're in a large urban area, that's where a lot of the purple air sensors are. And from a perspective like this study, where we're interested in outdoor agricultural workers, thinking if, how can we leverage these low-cost sensor networks, but make sure they're improving coverage in rural areas where we might already not have a lot of sampling networks from EPA, for example.
Okay, great. Thank you. The questions are flying in. Okay, are you able to translate exposure to mortality or respiratory morbidities?
Yes, so that's not something that we focused on in this study. My colleague, Coco Liu, who's a co-author on this work and who led the modeling component of this study, has made those extensions already, but in the past period only. And we can project this forward going into the future. As I mentioned earlier, something that we would like to do is collect data that's specific to agricultural worker communities versus looking at the general population effects. But that's been the extension of this work so far that Coco has led.
Great, thank you. What's your opinion about the idea of having a statewide notification or alert system that farm workers could receive when the air quality exceeds 151 for PM 2.5 from smoke?
Well, I mean, I think I'll start with my personal perspective. So I'm here in Los Angeles, and when we've had really smoky days, I've been surprised at how many people are out on runs. And when you can hardly see, you can't see the sun because the sky is so smoky. So I think in general, think about the general population, having more information sources for everyone is really important, so that you know what the risks are and you know some of the actions, behavioral changes that you can make. I mean, I do think it's a good idea to think through different ways that we can reach out to the agricultural worker communities and share this information so that people can take measures to protect themselves if that's available. And so I would say the more information, the more education, the better. And it's our hope that tools such as these can help to inform those efforts.
Got it. And I would probably say that in addition to the farm workers, all of the employers and growers and those who are making decisions around workflow, to the degree they're also made very aware of the current air quality, hopefully the more everyone outside can be protected. Okay, I have a really specific question that I received about interpreting some information on this table. And so I'm going to read it, and it might be our last question. But I think it sort of speaks to the significance of what you're saying the future might look like. So if I'm reading this correctly, let's see, it just disappeared off my screen. Based on the table, from the years 2046 to 2051, we will have 26 days greater than 150.5 PM2.5. So basically a month, a year, nearly covered in smoke. Is that correct?
So this is summing, we looked at the entire future period. So this is looking over the entire 6-year period. It's averaged spatially across counties, but it is summing across the whole future period. So yes, you're interpreting that correctly. I just want to add that caveat about the period that we're interested in. So as you see here, I mean, this is averaged across all of the counties. So there will be some counties that will be having more exceedances and some that are having less. But here we're averaging spatially for any county that exceeded that exceedance threshold.
Okay, thank you. I hope that was helpful. And I just thank you so much for this presentation. I think that it's such an important topic, and it's one that we at the Western Center are really focused on, both from a, we want to support the basic research, and we also are really committed to supporting employers and workers in knowing how they can stay safe while they are doing their critical work. So this is a really important piece of that puzzle. So thank you so much, Dr. Marlier, and we look forward to hearing about future research outcomes.
Great. Thank you for the invitation.
And thank you,
everyone.
Yeah, thank you everyone for joining us. Again, this presentation will be up on YouTube in a couple days, and we really encourage you to join us next month, the first Monday of March. We will be here again at 4 p.m. and we look forward to seeing you there. Thank you so much.